Tonight's first bedtime story is about fluoride. Fluoride is a naturally occurring mineral found in water. The amount that's in the water depends on where you live in the UK, where in the UK you live. Fluoride can help to prevent tooth decay, which is why it's added to many brands of toothpaste. Tooth decay. Tooth decay, also known as dental decay or dental caries, is a major health concern worldwide and is still a big problem in the UK. It can be prevented, but it's one of the most common reasons for hospital admission in children. Tooth decay is when tooth tissue is destroyed. It's caused by acids made by bacteria in dental plaque. Dental plaque is a sticky film that forms on the teeth. Each time you have sugary food or drink, the bacteria in plaque make acid that attacks teeth. If you eat or drink sugary foods often throughout the day, you would have more acid attacks, which can lead to tooth decay. This can eventually lead to cavities or holes in the teeth and infection, which is why teeth sometimes need to be removed. Fluoride toothpaste. Brushing your teeth thoroughly with fluoride toothpaste twice a day is one of the best ways of preventing tooth decay. A range of toothpastes are available that have different levels of fluoride. The amount of fluoride that's in the toothpaste can be found on the side of the tube and is measured in parts per million ppm. Toothpaste contain between 1,000 and 1,500 parts per million fluoride. Advice on fluoride toothpaste use is based on age and risk of decay. The general guidance is as follows. Your dentist may advise you to use higher strength toothpaste if you or your child is at higher risk of tooth decay. Children under 3 should only brush twice daily with a smear of toothpaste. Children between 3 and 6 years old should brush at least twice a day with a pea-sized amount of toothpaste. Adults should brush at least twice daily with toothpaste. The toothpaste should have at least 1,000 to 1,500 parts per million fluoride in it. Don't rinse with mouthwash or water after brushing your teeth, because it washes away the fluoride in the toothpaste. You can use mouthwash before you brush or at an alternative time. Fluoride mouth rinses. Fluoride mouth rinses can be prescribed for adults and children aged 8 and above if there is an increased risk of decay. They should be used every day, in addition to brushing twice daily with toothpaste containing 1,350 and 1,500 parts per million fluoride. Rinses should be used at different times to brushing to avoid washing the toothpaste off your teeth. Fluoride varnish. Fluoride varnish can be applied to both baby teeth and adult teeth. This involves painting a varnish containing high levels of fluoride onto the surface of the tooth to prevent decay. It works by slowing down the development of decay and strengthening tooth enamel, making it less likely to decay. From the age of 2, children should be offered fluoride varnish treatment by their dentist at least twice a year. If a child attends a nursery or school that is participating in the Child Smile Fluoride Varnish program, they may also receive 2 additional fluoride varnish applications. But however, is fluoride safe? There have been some concerns that fluoride may be linked to a variety of health conditions. Reviews of the risk have so far found no convincing evidence to support these concerns. However, a condition called dental fluorosis can sometimes occur if a child's teeth are exposed to too much fluoride when they're developing. To reduce the risk of mild fluorosis, the amount of toothpaste used by children should be supervised. Children under 3 years of age should use no more than a smear of toothpaste. Mild dental fluorosis can be seen at a very fine pearly white lines or flecking on the surface of the teeth. Severe fluorosis can cause the tooth enamels to become pitted or discoloured. It's uncommon in the UK for fluorosis to be severe enough to seriously affect the appearance of teeth. Time for our second bedtime lesson.